Do you know about adenomyosis? What is it? Do you know someone that might have it or are struggling with it currently? Follow me because I'm going to tell you so much more. Adenomyosis affects, we think, around 1 in 10 women in the UK. It happens when the cells from the lining of the womb are found in the muscle wall of the womb. These cells grow, break down, then bleed during each period. This can cause heavy, painful, or irregular periods. Here's the thing when it comes to the symptoms. Around 1 in 3 women actually have no symptoms. And if you do, the most common are going to be heavy, painful, or irregular periods. You can get some pelvic pain or tummy pain as well just before your cycle starts. You might feel some heaviness or discomfort in and around your tummy and bloating where your tummy comes out a lot as well. Some other symptoms that women complain about are pain during sex, pain when having a poo, or they might feel that they're actually just heaviness always in the inside. It gets mixed up with endometriosis and fibroids, but these conditions are very different from each other. We don't know why adenomyosis happens. It could be linked to genetics, so it's well worth asking around in your family if anyone else has similar symptoms. We think it might be a problem with the immune system or an issue with hormones. The research is still ongoing. If any of the symptoms that are described, you think, oh my goodness, that sounds like me, I might have adenomyosis, and you're worried about a change in your periods, then please go and speak to your GP, or especially someone in the practice who does women's health. Keep a track of your periods and symptoms in a diary to show to your doctor. The GP will ask you about your symptoms. They may examine you. They might then send you for an ultrasound scan, which is known as a transvaginal ultrasound scan. This is when a small ultrasound probe is gently passed into the vagina. You might also have an MRI scan to investigate your symptoms. So there's a whole load of different things that we can do to get the diagnosis. Now, here's the thing about adenomyosis, which we don't tell a lot of women. Most cases of adenomyosis is found in women in their 40s and women who have had children. However, we are trying to get better at diagnosing adenomyosis in younger women because unfortunately, sometimes even on a scan, it can get missed. Adenomyosis does not appear to decrease the chance of pregnancy. In fact, many women get pregnant even if they have adenomyosis. Some women may experience an increased risk of miscarriage and premature birth, but the research into that is still ongoing. Sadly, there is no cure for adenomyosis, but treatments can help you to manage the symptoms. Your treatment will depend on your symptoms and what's right for you and where you are, and definitely if you're trying for a baby or if you're nearing menopause. Now, you may choose to do nothing. Some women actually find that they only find out their diagnosis by accident on an ultrasound scan. There are medical treatments that you can have, so medications such as tranexamic acid or mefenamic acid to help with heavy bleeding and pain. Hormonal treatments like the contraceptive pill, coil, or the injection can reduce the bleeding and your pain as well. And removal of your womb. So this is a surgery called hysterectomy where we take away your womb to stop that bleeding process and the pain. Now, a uterine artery embolization. So this is a procedure where tiny particles are injected into blood vessels to block the blood supply to the adenomyosis, causing it to shrink. That can also help in some cases as well. When it comes to conditions like this, honestly, I know it's exhausting, but some women find mindfulness, yoga, doing hot and cold therapy, using a TENS machine, using an ice pack, using simple pain relief, paracetamol and ibuprofen if well tolerated can help. Eating well, drinking less alcohol, stopping smoking can all help to manage your symptoms, and obviously maintaining your weight as much as you possibly can.